Robert Johnson from Natchez Way, Minority Leader, District 94, Adams, Franklin, Jefferson Counties, Vice Chair of the House State Affairs Committee. Good morning, sir. How are you?
Good morning, Paul. Good to be here. Good to see you. It's been a while, but I'm glad I made it in. Yeah.
Well, you've just been going on all the other shows and not on here for some odd reason, and I'm sure it's just a snafu.
Yeah, it's just late in the day as opposed to early in the morning.
I'm telling you, man. You take the lead on this one, Robert. First of all, which one do you want to talk about first? I mean, we got PERS, we got the education bill. What's on your mind? What's passionate and on your schedule there?
Well, Medicaid is the most important thing to me right now.
All right, let's talk about that. Where is it? What happened over the weekend? Did anything happen?
Well, there had been a stalemate, but over the weekend, the two chair people of Medicaid from the House and the Senate started talking again, and it's been productive. It's been sort of slow, but it's been productive. I understand that the Senate has submitted a proposal to the House that I haven't had a chance to look at yet, but that they received yesterday. The important thing is that there was a time when the Senate said they would not move. There were issues that the House was concerned about, but the Senate has moved a couple of times, and so there are just a few things we need to get worked out.
All right. Well, wait a minute. Is there any movement at all as far as the work requirement? Because that's been the snafu.
I don't know. I think the Senate has dug in on the issue of work requirements. The House wants a work requirement too. We just want to submit an application that essentially says we want a work requirement. If you don't approve the work requirement, we want to be able to expand Medicaid anyway. And in the meantime, we're prepared to continue to ask for a work requirement. Even we will even agree to allow or support the Attorney General suing on behalf of the state to get them to give us a work requirement. But it should not be the reason we don't take the $1 billion a year, the $650 million incentive, and get coverage for working people in the state of Mississippi.
But in face of an administration that is anti-work requirement, it really is meaningless, isn't it?
No, it's not. Look, we don't know what's going to happen in the election come November, and we don't know. There was a time under the Trump administration where work requirements were allowed and were allowed to be approved. But let me say this: in the 13 states that had work requirements under the Trump administration, only about 11 of them actually implemented work requirements. They have them on the books, but they allowed everybody to be covered, even though they had a work requirement. They didn't spend the $122 million that Georgia has spent just trying to get the work requirement put in place. I mean, everywhere they've tried to do it, there are 5 states that did work requirements, and they spent $408 million. This is the Office of Management and Budget in the federal government. Says $408 million just trying to get it implemented. When they found out that 90% of the people nationally, 90% of the people under the expansion program who submit application for Medicaid already work. So, I mean, you're asking for a requirement that already exists. You understand that to get Medicaid, you got to show income anyway. So you got to be working.
That's my next question: is have you been given a figure of how many people are who may partake in this are already working
in the state of Mississippi?
In our state, yeah.
In the state of Mississippi, I can't give you the exact. Right now, we know it's at least 200,000 people, but 80%. It's the estimate is that 87% of the people who would be eligible under the expansion are already working.
Yeah. Do you worry about people who have a insurance policy now dropping off and getting on the free policy?
No, because one of the facets of the compromise was that the people that are 100 to 138% of poverty, which is the population of people who are most likely to already be on the exchange, they will stay on the exchange. That population of people, in fact, we will administer the expansion for that population of people on the exchange. So they will have private insurance. The only people that have pure Medicaid were people making just like $15,000 or less a year.
Are you okay with the 4-year sunset on this?
I'm
Come
fine
back
with
and look at it.
I'm fine with it because I believe in the program. I think it works. I think it puts people to work. I think it makes people healthy and makes us more productive. So yeah, I'm
And
fine
do you
with
see any evidence that Medicaid has made Mississippi healthier? I mean, the existing program itself.
that. Absolutely. Absolutely.
Really?
Yeah, it helps lower the infant mortality rate. It helps people.
We're still number one in infant mortality.
I know, but we're not as bad as we used to be. And the reason we're still number one is because there's a huge population of people out there who do not have coverage. The other reason is because there are hospital rooms and neonatal intensive care units and emergency rooms that are not open. So you know if you don't have anywhere to go to get treated, that's going to increase your numbers. So
in your district is there, which is District 94, Adams, Franklin, and Jefferson County.
Yeah.
Are the health centers there up to where they should be over the last several years?
No, our services have declined. We used to have just about every.
Well, why? You've been in the legislature for a while. Why haven't we taken care of that? It seems that's a point of contact.
That's money. That's what this Medicaid expansion is about. We don't have the money. You can't keep a hospital open if they don't have the money. There are hospitals that are operating.
I'm not talking about the hospitals. I'm talking about the health centers themselves.
The
community
health
centers.
department.
Health departments.
The health departments. You look, the legislature, the governor, they cut the health departments. Dr. Edney is doing a good job now of trying. He's got a pilot program.
Yep.
Actually, he's going to do it in Southwest Mississippi, where we're going to open health departments like we used to have, and have places where people can go and get treatment for, things like colds and flu, those kind of things. There's a pilot program going. Right. We need to go back to doing that. I agree with you.
Well, I agree with you. And to me, as far as the hospital is concerned, it seems that this would benefit those community health centers.
Well, I mean,
as far as Medicaid expansion.
Medicaid expansion will benefit every provider, every health provider in this state will benefit as a result of expanding Medicaid.
All right. How do we get people in this state? We are number one, and how do we do this, Robert? How do we get people who are able-bodied people? They ought to be working, but they're not working. How do we get them off of the unemployment line and into the job force?
Well, according to the governor, we have the lowest unemployment rate we've had in years.
But you still have the number one amount of people who can work and don't work.
Nah, you have low worker participation. And that's because that has a lot to do with, a lot of it has to do with health, a lot of it has to do with transportation, a lot of it has to do with child care. It is a fiction to say that there are people out here who don't want to work. There are mothers out there who are working every day and are trying to work. They either have transportation issues. We don't have any mass transit. We live in a rural state, and so we need to fix that facet. Some of that can be done. People have done some of that through Medicaid expansion programs, and we need to have child care.
We need an hour with you, and time's going to be shot to death real quick here.
You want to talk about retirement?
Yeah, let's talk about PERS, because there was some movement on PERS, and what was it? David Parker had a bill 3231.
Yeah, we passed that out of the House a day or two ago, and I don't think we passed it with just one no vote. I understand there were at least 14 votes in the Senate that voted against the bill. But look, I think it's the main thing it does. It doesn't affect benefits. There is no change in anybody's benefit. But what it does do is that we take the recommendations from the retirement system when it comes to employer contributions. And so that decision will be made by the legislature as opposed to being made just by the retirement board. The other thing we're going to do is we're going to infuse the retirement system with cash. It wasn't in this bill.
How much?
But at least $120 million
on a one-year basis.
Well, no, it's going to be annual. We're committing to do it in more than 1 year. That's the commitment that was made.
About $110 billion. Is that in the bill itself?
No, this is going to be in a separate appropriations bill.
All right. Let me read a little bit of this bill, because it sounds like the bill basically takes the present board and just neuters them. They become no more than an advisory board. Am I right?
Oh, it doesn't completely neuter them. It just neuters them to the extent that they
It's like being a little bit pregnant.
Yeah, I know. The main authority we take away from them is their ability to say to employers, you got to raise your contribution.
But whatever they come up with as far as an advisory has to go through the legislative process.
Yeah, they advise us, and we're going to require 2 actuarial opinions as opposed to 1.
Now, is this ready to go to the governor's desk?
Yes.
The act to provide that the increase in employers' contribution rate that is scheduled to take effect on July the 1st is rescinded to provide for a 0.5% increase in the employer's contribution rate July the 1st of each year from 2024 through 2028. There you are. And if you want to look at this more, it is SB 3231 more with Robert Johnson coming up next. So many times over the years now, how are we going to start saying MSFF? I don't know who came up with that one.
I don't know, but I'll just call it public education. I'm done with the acronyms.
Mississippi, I think it's the Mississippi Senate funding formula, but I think they put it Mississippi Student.
Yeah.
Funding formula.
Yeah.
You looked over this. Are you okay with this one?
I have some apprehension about it. The things that I was concerned about, the conferees were able to work out. One of the main things was actually getting a layout of a real formula, see what it does, have some assurances that school districts will be protected. And so far, I'm satisfied, but I'll continue to look at it. I mean, it's a new system, and so I think it bears watching, and I think we have to be, pay close attention to it. But right now,
have you run the numbers on your schools in your district?
Yeah, my district has something like I don't know the exact number, but it's in the millions in terms of increase for funding. So
$218 million more as far as K through 12 is concerned.
Yeah, that's a good thing. It's hard to argue about that, and I applaud the House and Senate members who worked on it, the House members who helped put this together, and I applaud them to the extent this looks like a plan that will work, and I hope we continue to look at it and make sure that we take care of our school districts. I suspect, because it's similar to a plan that was implemented in Tennessee, that we're going to see a lot of people trying to use vouchers. It'll open the door for that, and I'm a little concerned about that, but we'll see how that works out.
My guest coming on in a moment or two is going to be Hob Bryan. He'll be in that chair. And he voted against it. Yeah, him and Angela Hill and somebody else voted against it. In the Senate, they were the only 3, and one of his problems was, and I'll ask him about that when he comes in, has to do with transportation wasn't inclusive in that.
Yeah, I mean,
as far as buses.
Right.
Is transportation in the MAEP, though?
Yeah, all the school costs are part of the formula in MAEP. And so I don't know how they're going to address that. They admitted that number was not there in terms of the formula, and that's what concerns me. When you don't put that in there, that means so you're not considering that's not part of the act. Even though there's a higher base student cost under this plan than there was under MAEP, it concerns me that transportation wasn't configured.
Well,
that's a problem.
Could that be written in as part of the $218 million plus?
Yeah.
And if that's the case, then you're usurping some of the money.
Yeah, I mean, it could be. I mean, that's what I mean. There's still some unknowns and things that we need to make sure we look at and cover. But $218 million more in public education, at least for the immediate future, is a good and great thing.
Well, for my friend Willie Simmons and the rest of the folks, it was SB 3165. Let me throw this out also. MDOT got some additional funding. Briggs Hobson, the author of that bill, an act to make an additional appropriation from the Coronavirus State Fiscal Recovery Loss Revenue Fund to the Department of Transportation. You want to mention anything on that?
No, I mean, just I'm a big transportation guy. I think that's what drives our economy in every state, and our highway departments are still, I think, dangerously underfunded. We still need to get to a point that we are in the hundreds of millions that we need to maintain our current highways. We just don't fund it enough to make sure that we keep roads up to speed. But the commissioners are doing a great job of what they have to work with.
Let me backtrack again on the Medicaid bill. Do you think there's enough support in the House and the Senate, of course, but I think the Senate's okay, as far as the House is concerned, to be veto-proof, or as far as from the governor?
Well, I don't know if the Senate is or the House is. I don't know about the Senate, but yeah, the House. It depends
you think
on
the House is?
Look, we still got to make sure that we have the votes to. I don't know what the Senate has sent over, but if it's one that the House will vote and approve, it's also one that is veto-proof as well.
Was there anything else that you thought was going to make it through that just didn't this year? And I know the initiative process was one of the things.
You beat me to it, yeah.
Yeah.
Initiative is the. I'm surprised that the leadership did not insist that we get a clean initiative bill and get it through, because that's what people ask for.
One of the things that you hear a little bit of rumbling on this one, because we made a major outlay for PERS.
Yeah.
We've got that teacher pay raise, which is going to be millions and millions of dollars.
Yeah.
We've sunk money into several different things here. We do have a rainy day fund, but there is something called Bidenomics out there, and it doesn't look good for a while. Are we beginning to worry a little bit that we have overspent or not?
No. Most of what we spend money on has been one-time money. The recurring funds are well within the range of our budget. We're $75 million over the estimate this year. There has not been we're not just throwing money out there. We have a manageable budget, and we're going to keep it that way.
Always a pleasure, sir. I thank you. We just didn't have enough time.
Yeah, we never do. Do. But I'll be back sooner.
Please do it, and we'll give a wrap-up of the legislative session. How about that?
That sounds good. Thank you.
You got it. Robert Johnson, Hot Brian's coming in, 8:05. He is not happy with 2790.